Move to Leaders' Questions. Under Standing Order 36, we call on Deputy Mary Lou McDonald, the Leader of Sinn Féin.
Thank you. Minister, a report published by HICWA this morning is a damning indictment of government health policy. The report states that emergency departments are now under what they call unprecedented strain, echoing the concerns of the INMO that our hospitals now face a nightmare winter. Last month was the worst November on record for hospital overcrowding. 12,624 patients were on trolleys. The HICWA report cites that one patient in University Hospital Limerick was left waiting nearly 5 days for a bed, and that's not a unique case. Every TD in the Dáil has stories of patients being left on trolleys for days on end. Chronic overcrowding creates dangerous situations, and HICWA particularly highlights how patients are often waiting far too long to be triaged for care. So it is Minister Donnelly's incompetence and inaction that is at the centre of this crisis. After 2.5 years in office, he has failed to do what needs to be done. Firstly, patients can't get admitted because a quarter of the beds promised by government more than 2 years ago have not been delivered. Secondly, the Minister hasn't solved the delayed discharge problem. There are as many delayed discharges in the system as there are patients on trolleys, and patients can't be discharged from hospital because of the lack of community recovery and step-down beds. And thirdly, Minister Donnelly has failed to solve the crisis in home care. We now have more than 5,000 older people on home care waiting lists. This has been brewing for some years now, and it sees older people pushed into hospitals and nursing homes when in fact they should be cared for at home. There are no carers available to them because the Minister has failed to plan a sufficient workforce or to address long-term pay and conditions issues which have harmed recruitment and retention. And at the same time, Minister, people can hardly see a GP anymore. This exerts even more pressure on hospitals and emergency departments. So if progress is ever going to be made, the government has to get serious about delivering the right care in the right place at the right time. This means urgently building bed capacity in our hospitals. It means rapidly increasing our community and step-down beds. And we need a clear plan to address the lack of GPs and deficits in primary care. And crucially, the government must invest in home care for our older people. Thespon and Thurscol Hicwa and Ugar Horla on Ro Flodus and Usna Uspedel Gadirik the War Tepper Ara Donnelly Saflanol. Tep Umlan Atá Aun, Kuntilla Lapacus Savresh occur fall. Agus tá an aspa in estiach the gorum pubble, agus balya occur brew an gorus, as a dog an irvorchi trum kushaka. The government's lack of planning and lack of urgency in getting to grips with the bottlenecks in our hospitals must now end. So, Minister, I have a number of questions. Minister Donnelly has promised 51 additional consultants for our emergency departments. How many are now in place? For months, the Minister has promised an action plan to tackle hospital overcrowding. We haven't seen hide nor hair of it. Where is this plan? And Minister, can you explain, please, why 1 in 4 beds promised by government have yet to materialise more than 2 years later? When will we see these beds come on stream?
Thank you very much, Deputy McDonald, for raising what is a serious issue for many people who are impacted by overcrowding in our ED departments around the country. It's not every ED department, but in some the situation is quite serious. The Minister has, of course, read the HICWA report and will respond to it formally in due course. But in broad terms, he and the government accept the HICWA report and what HICWA is saying in that report, in particular the points they've made around workforce planning, around management, around bed capacity and indeed diagnostics, and the type of individual examples that you have highlighted, that your colleagues highlighted last night in the Dáil, are not acceptable to the government. government and are not acceptable to the HSE, and so we do need to do better. We do also have to recognise that the 136,000 professionals working in our health service are delivering good outcomes every day for patients across a whole range of specialties, in cancer care, in cardiac services, in stroke services, in our maternity units and so on. And I know that is a given, but it's important to say it and to put it on the record as well. And I think the context is important also. I know that last night your party had a motion before the House in relation to this issue and the challenges that are presenting in our hospitals. There was no mention of COVID-19, a global pandemic, a one-in-a-century event, the effects of which we are still very much living with because COVID is still here at this point in time. And we acknowledge the case that demand on services has grown very significantly because of COVID, because of RSV, because of flu and because of Strep A, and the difficulties that are evident in our hospitals and some of our ED departments are not unique to Ireland. You'll be well familiar with the situation in Northern Ireland in particular, and in England, Scotland and in Wales as well. And I know that the European Centre for Disease Control warned earlier this week of the impact of COVID, RSV and flu on health services right across Europe. That said, of course, we have to do everything we possibly can to address the situation. I heard Minister Donnelly last night in engaging with your health spokesperson mention University Hospital Waterford and the fact that come Saturday they will have achieved 1,000 days without a patient on a trolley. And I believe the HSE need to examine very carefully where best practice is occurring and how that can be replicated elsewhere around the country. And of course, some of it will come down to investment, it will come down to capacity, beds and staffing, but it also comes down to effective management. Because when I look at this in the round, I look at a budget in healthcare that is now 24% higher in core funding than it was in 2020. Minister Donnelly has delivered over 900 new acute hospital beds, 73 subacute beds and over 340 community beds. Critical care capacity, which we acknowledge was not where it needed to be, is now 25% higher than it was in 2020, and it will continue to rise. And we've had a 25% increase in the number of specialist palliative care beds across the system. The action plan that you refer to is the winter plan. It's fully funded, almost €170 million. The Minister, his department and the HSE are now working to implement that plan to recruit more staff. A further 608 people will be recruited as part of the winter plan. We have increased the workforce in health by over 16,000 people in the last 2 years, the largest ever increase in the workforce in health, because we recognise it is a priority. We have had to build up the permanent capacity, both physical in terms of beds and staffing, to meet the demands of a growing population, growing complexity in terms of healthcare provision. We can and we will do more.
Thank you.
So, Minister, don't reach for the good staff in the health service, the 136,000 of them, to try and hide behind them. Don't reach either for Tory austerity in Britain to try and spare the blushes that you rightly carry for your absolute failure in resourcing our health service. This Minister Donnelly, has a penchant for plans, for launching plans and announcing them, but very often he does not deliver them. And the winter plan was something announced quite separate from the plan for overcrowding in hospitals. I asked, where is that plan for overcrowding in hospitals? Clearly it doesn't exist. That's the only conclusion that I can draw. I also asked you about bed capacity, and you're currently the Minister for Public Expenditure. Riddle me this. You make an announcement in 2020 promising 1,200 new beds. 2 years on, a quarter of those beds have not been delivered. This is a crisis of capacity and staffing, a crisis of investment, but above all else, a political crisis and an abject failure of leadership from your government and Minister Donnelly.
Thank you. Minister McGrath.
Far from hiding behind the staff, we are standing with the staff and we are investing in the Irish Public Health Service. This government has approved a new contract offer which has been made to hospital consultants. It's well recognised we need far more consultants in our system. We need them to be present at our weekends, and we need over time to remove private healthcare from our public hospital system. Minister Donnelly and his team in the Department of Health and the HSE have done an excellent job in delivering a package that we believe has the potential to be a game changer in terms of the provision of consultant-led care in the public hospital system. It's a matter now for the representative bodies to consider whether or not they're going to accept that. We very much hope that they do. You mentioned about home care. 20.5 million hours of home care support delivered in 2021. The constraint is not funding, the constraint is staffing. That's up about 17%. We've had a record increase in the delivery of bed capacity in acute, in subacute, in community care, in critical capacity, and we will continue to do more. We've increased the health budget, as I said, by 24% over the last 2 years, recruited an extra 16,000 new healthcare professionals. There are growing demands, but the Minister and the HSE do have a plan that they are focused on implementing, and I think we need a degree of balance and fairness in the presentation of these issues.
Thank you very much.